everyone. Today I'm going to talk about fox eye surgery and brow lift surgery. Sometimes our patient wants to have this kind of eye. Actually, I don't find it very natural, but there's one point. If you want a slight slant, we can just lift the corner of the eye. There's a ligament there. You can tighten up and you can make it a little bit lifted. It's not a problem, but sometimes patients want too much augmentation on the outer part of the eyelids. So it's not just cosmetic, also functional. It may create some problems. I just want you to mention about that. So if you have a negative vector, it means that your corner of the eyelid looking down. It's good to make this kind of surgeries, so it will make your eyes looking more attractive. Most of the time we combine these procedures with brow lifting and with cheek lift surgeries. Patients usually want, and I find it also nice, a look that when they bring their hairs together and it makes this kind of look. This is really looking natural. It's not like an exaggerated look. So this is one of the goals of this surgery. So I recommend that kind of thing. But this excess changing of the eye slant, I do not recommend it. And there's a difference between these two. In one surgery, you just tighten up. The other one, you just cut it and stitch to the bone. Sometimes it may be problematic or dangerous, but in patients, for example, who had previous lower blepharoplasty and some complications like an ectropion of the eyes, we are using these techniques very successfully. But just for cosmetic reasons, these exaggerated surgery, I do not recommend. There is one important point. While we are doing this brow lift, we call this temporal lift surgery, also we give some, at the beginning, we give some this exaggerated look, but it will become more natural, more normal with time. That's an important point. And especially 2-3 weeks later, it started to look more natural. This is very important because sometimes patients want their slanted eyes stay exaggerated slanted. In that moment, we are doing different kind of surgery, but also every time when you have this amount of change, you need to think about positives and some consequences may occur. That's an important point. But for overall eye rejuvenation, upper blepharoplasty, lower blepharoplasty, with just some canthal ligament tightening, probably your eyelids, your general view of your eyes are going to look so much better.